guys and welcome back. If you're new here, you're very welcome. My name's Laura and in this video I'm going to be going through all my top tips for the situational judgment section of the UCAT. I want to give you guys the best advice so you can do your best in this section, and in this video I'm going to be covering all the things that I did to do well in this section. So I'm going to be giving you some of the hints and tips that I picked up along my way while I was doing the UCAT, and hopefully you'll be able to put these into practice and do your very best in the situational judgment section. So the situational judgment section of the UCAT is the fifth and final part of the UCAT, and it's testing your ability to see how you would react in certain real life situations and how your behaviour would be in these scenarios. It doesn't assess any of your academic abilities like English or maths, it is really just how you ethically respond to a certain scenario. So why is this included in the UCAT? Doctors have a really key role in being able to adapt and behave appropriately in many different situations, so it's really important that universities are able to select students who can cope and deal well in different scenarios. The situational judgment section is based around ethics, empathy, integrity, and teamwork. It's assessing if you have the right sort of morals and behaviour to be a great doctor. And overall, if you have good people skills and communication. So the situational judgment section is very different to a lot of the other sections that are included in the UCAT. It's not looking for academics and it's not testing you on any form of English or maths skills. Along with this, it is also marked differently, which I'll come to later on. So what are the timings like for this section? So in the situational judgment section, you have 26 minutes to answer 69 questions. These questions are related to 22 different scenarios. If you break down the time and do a bit of maths, you'll realise that that means that you've got around 22.5 seconds per question. It seems like very little time and it can be quite rushed. However, once you've read the scenario, it kind of speeds things up with the questions that follow. So really, once you've read the scenario, that's sort of the main amount of seconds used up for the next questions that follow. So as I mentioned already, the situational judgment section of the UCAT is scored differently to all the other sections. Instead of having a score from 300 to 900, it's scored from bands 1 to 4. Band 1 shows that you have used your ethics and morals and were able to behave appropriately to each situation. Whereas a score in band 4 means that it was not appropriate behaviour, and you can sometimes find that universities won't accept people with bands 4. So if you're wanting to go to certain universities, do check what their specifications are in regards to the situational judgment section. Some universities won't look at it at all, however some universities do think it is critical and a very valuable thing for a doctor to be good at, therefore they do weight it quite highly on their criteria. Therefore they may only allow students that achieve bands 1 to bands 2, maybe 3, to apply to their universities. So there are 3 different types of questions that can be asked in the situational judgment section. With each scenario, there are passages of about 50 to 150 words to read, which is kind of like a small paragraph, and it shouldn't take you too long to read these. The questions that follow will then all be related to that one scenario until you see another scenario of text. So the most common type of question is the appropriateness question. So these questions are based on how appropriate something is, maybe someone's behaviour or how they act in a certain scenario. You are asked to rate these from very appropriate to very inappropriate, and there are 4 possible types of appropriateness to select. There's very appropriate, appropriate, not appropriate, and very inappropriate. If you would like an example of one of these questions, go and check out the description below and click the link to my Instagram page where I'll have created example questions for each of the situational judgment question types. So the next type of question is the importance question, and this is basically very similar to the appropriateness question in the same style of format, but instead of being appropriateness, it's how important something is. So it might be how important it is to act a certain way in a certain scenario. Again, you can consider these into 4 different types of importance. From very important, important, not important, and not at all important. Like in the appropriateness questions, you are using your ability to know that things are right and wrong and your ethical morals to decipher what the best course of action to do in each of these scenarios would be, and then selecting the importance or appropriateness to which degree that you think something should be handled. And again, if you would like an example of these questions, please go click the link in the description below to my Instagram, and there will be examples on my page for how you can answer these questions and what they sort of look like. Then finally, the third type of question that can be asked is like a drag and drop style. So you will, as before, read a scenario, but instead of choosing the most or least appropriate action or the most or least important thing to do, you will be ranking them in a sort of order from most to least. This means at the end of that question, you should sort of have an order of things that you think are the most appropriate things to do in that situation, or the least, in a sort of like chronological order. So common themes in the situational judgment sections would include things like teamwork, communication skills, someone's honesty, if they lie, something to do with maybe the negligence of a doctor or a medical professional. It might be to do with confidentiality or the care of a patient. Quite often they use examples of how people work together in certain situations, like 2 junior doctors on a ward, or the relationship between a consultant and a junior doctor and a medical student. There are lots of different topics, and it's a good idea to get a wide range of questions and examples so that you're familiar with how to react in all of these situations. So now for some of my top tips on how to do your very best in this section, and these tips are the things that got me through this section with a very good score. So my high recommendation would be to go and read the GMC and read the good medical practice that doctors are meant to comply to when they sign the Hippocratic Oath to become a doctor. The good medical practice is basically a document that contains all the codes of conduct that a doctor must sort of uphold as they practice as a medical professional. By reading through some of this, you will get a good, clear understanding of the rights and wrongs that a doctor must comply to, and it will really help in the situational judgment section. From the good medical practices of a doctor, you'll be able to spot a lot of the ethical and moral concerns that many health professionals have to deal with and how they should deal with them appropriately. It's super important to be on top of all of these because this is basically what the situational judgment section is testing you for. If you would like more advice on the GMC and good medical practice, go check out my video all about this, and it contains a lot more hints and tips on how to use this effectively at both the UCAT and your interviews. So whenever I began looking at the situational judgment section of the UCAT, I found it really hard to decipher between some of the options. I kind of was toying between a couple of them because I didn't really know the context and the background to each scenario, and therefore would react slightly differently depending on what that was. Over time, I realised that because of the nature of the situational judgment section, the examiner is only looking for you to respond to the text that you can see, nothing more. You're not meant to sort of make up a background story or think of anything extra. It is literally just as you see it. Therefore, my big recommendation for this section is to not jump at the first thing that you would do in that situation. Instead, think about it logically and cleverly, like the examiner would want you to think. It is hard to take things out of context, but at the same time, you have very little precious seconds to devote to each question. So it's important that you read the text, you understand what you've read, but you don't delve any deeper into it. Basically, take it at face value. What you see is what you get. Over time, things will get a lot easier and you'll be able to see things as if you were the examiner. Another top tip of mine would be not to overthink each situation. It's really easy to start overthinking things and looking too much at each option and then thinking about things that you might do in certain situations and might not do if it was a different scenario. As I've said before, take it at face value, don't overthink it and don't waste time deliberating over one or another option. So once you've read the text, follow your instinct and try to stick as closely to it as possible without overthinking things and wasting time. Don't read into words and get bogged down on the minor details. Simply take it at face value, pick an answer and move on. More tips for this section would definitely be to practice your skim reading. It's very important for all the sections of the UCAT and it is as well in this section. It's important so that you can spend as little time reading the scenario but effectively take out as much of the information that you'll need to answer these questions. To practice skim reading, read things just in your everyday life as quickly as you can but effectively and find out if you can pick out the important information. It could be something simple like on Instagram, Facebook, Snapchat, but as long as you're able to pick out the key details and spend as little time reading it as possible, you'll get better and better at this over time and you'll see huge improvements in your skim reading ability. Another tip would be practice the keyboard shortcuts. This is important for all the sections in the UCAT and especially in the situational judgment section so that you can speed through each section and not waste time dragging and clicking a mouse. If you'd like more help on these shortcuts, go check out my UCAT shortcuts in a full video all on its own. It's full of all the tips for the keyboard shortcuts and will save you valuable seconds and allow you to do well in these sections. Another tip would be don't watch the clock. It is very important to stick to timings and by only having around 22.5 seconds per question, it will be quite tight for time. However, watching the clock and counting down the seconds is not going to help you answer a question. So by watching the clock, you are just wasting more of your time. It's good to have a guide, but don't watch it religiously and get too panicked and worked up over it. Remember, in this section, all the questions are worth the same number of marks, like in all the other sections of the UCAT. So don't waste time on questions if you're not sure what they're talking about or haven't got a clue on how to answer it. Use the guess, flag, and then skip options that I've talked about in all my other UCAT videos. This is a really vital way of saving valuable seconds and allowing you to do well in each section of the UCAT. Simply guess what you think it may be. It doesn't have to be the right answer. Then flag it with the little flag icon at the bottom of the screen and then simply skip on to the next question. Some questions will be simpler than others, so it is a good idea that if you are stuck to simply guess, flag and skip and find those easier questions, and those harder ones you can come back to at the end if you have some time left over. So as the situational judgment section is the final part of the UCAT, it can sometimes be hard to keep concentrating and focused. In my opinion, it was definitely one of the sections that I just couldn't wait to get finished with because I was just drained and ready to leave the centre. It's so important though to keep marching on and to keep focused because missing out marks that are quite easy to get in this section would just be such a shame when you've worked so hard already throughout the rest of your UCAT. So try not to get complacent and do keep working hard in this section because you're so near the end of the UCAT. So my final tip, and one of the most valuable tips, would be go and use online resources to practice these questions. There's no point just reading from different pieces of extracts and books. Do get used to the online format of the UCAT because it is quite different to what a book or something would be like. I've made a full video on all the best websites and resources that I used when going through my medical application process for the UCAT and for other sections, so do go check it out. I'll put it in the link in the description below. So that's it for this video, and I hope you found that useful. If you did, please go give it a like down below, and please hit that subscribe button down below as well to keep up to date with all my new content and videos that I'll be uploading to help you get through your UCAS and UCAT and interview process for applying to med schools in the UK. There's loads more on my channel, so go check it out if you are stuck and need help with anything medicine related. If you would like me to answer any of your questions, please go check out my Instagram or simply leave a comment down below and I'll be happy to get back in touch. Thank you for watching, and I'll see you in my next video. Bye bye!